Hi everyone, this is Dr. Katie Rose in Tucson, Arizona. I'm coming from my office at Nature Medica, and you'll have to bear with me because this is my first live video, or at least my first intentional live video that didn't involve my 1.5-year-old accidentally turning live on without me realizing it. So hopefully this version will be less embarrassing. Today I want to talk to you guys about recurrent urinary tract infections. And I know people are probably like, whoa, your first live video, and that's where you're going to go with it. But this is an area that is really important to me. This is actually the reason I found naturopathic medicine in the first place, was as part of my own healing journey. And I went through significant urinary tract infections in my early 20s, and it really came to me seeing a naturopath to figure out how to get to the root of those. It's also something that I've seen in my practice a lot, and it's something that I hear about from many women, and unfortunately it seems like most of the time we're not getting to the root of that problem. And the tools that we have as naturopaths can help people get to that root problem a little bit more easily. So I wanted to talk about what to look out for with recurrent urinary tract infections and give some tips on how we can get through those a little bit more easily. So about 80% of women will experience a urinary tract infection at some point in their lives, and this is usually involving pain with urination, urgency, frequency, and for some women it can be really depressing too, to experience that type of pain. It's such a vulnerable area as well. Now, 25% of those women who get urinary tract infections will actually get a recurrence as well. And this can happen either because the original infection was never fully treated. Maybe the antibiotics that were chosen weren't the correct antibiotics for that bacteria, or maybe a new infection cropped up altogether. So one of the first things that's really, really important is you have to get the urine cultured. You have to make sure that you know what bacteria you're dealing with and that you are choosing the correct treatment for that bacteria in the first place. And the problem is I see a lot of women who maybe they just went to urgent care for the UTI and they get an antibiotic based on their symptoms. They never hear back. They don't even know if it got cultured. And the next time it comes around, they go to the same urgent care, but maybe they see a different provider. This is a story I hear over and over and over again. So get that urine cultured. That's a huge part of figuring out where to go next. You also want to ask for a sensitivity. And the sensitivity is when they culture out the bacteria, and they're also looking at what antibiotics are going to be most helpful in killing that bacteria. Without this, you're kind of just shooting in the dark when you're choosing an antibiotic. If you are taking an antibiotic, you also want to make sure that you are finishing the course. You don't want to stop taking it as soon as you start feeling better, because this is one of the reasons we see resistance to antibiotics in infections. Is people start feeling better and they're like, well, I probably don't need to take it anymore. I'm just going to stop it. But then you have a certain population of that bacteria that's still around and can start forming their population all over again. Now, for some women, they get to a point where they've been on so many rounds of antibiotics, and this was my personal case, and I think I'd been on maybe 12 rounds of antibiotics in a year and was just feeling really depressed and demoralized and was like, what's it going to take? Clearly the antibiotics weren't really getting to the bottom of the picture altogether. So you have to look at what is making women susceptible to UTIs, and this can be anything from hormone changes, so starting birth control pills or stopping birth control, getting pregnant, going through menopause. All of those hormonal changes can change the pH, and basically the different bacteria that live in the body normally will change as well and leave women more susceptible to UTIs. So that's just one area, and that's a pretty big area for women. They're going through hormone changes at many different points in life. You also want to look at the overall immune system. So if stress has been really high, if they've been on a lot of medications, if they've been doing chemotherapy or medications that are used in autoimmune diseases, this can really knock the immune system down and leave people more susceptible to infections as well. In many women cases that I deal with, we see not only the bacterial infections, but because they've been on so many antibiotics, they're also getting yeast infections, and their whole microbiome just really needs to be repaired. And sometimes that's all it takes, is getting to the root of balancing their healthy bacteria. So, what are some tips on how we can do that? Well, from my perspective, if we can do some hormone labs, and we have something to have kind of as like a baseline. Now, that's not very helpful in women who are on birth control because all the hormones kind of look suppressed, but in women who are going through menopause, that's an example of something that's helpful, is figuring out where their hormone levels are. You also want to find out, there's some obvious hygiene tools that can be effective in preventing urinary tract infections. Although I will say that with most of the women I see, they're already utilizing all of those tools very effectively, and they're still getting UTIs. So that's not their root issue. And that certainly wasn't my root issue either. And I think that's an area that there's a lot of judgment, and it can be very awkward, going to see a new provider when that's, your chief concern is UTIs, is, they give you this look and they ask you, are you washing yourself? And most women are like, yes, I think I understand how to do that. But it is a question to make sure you address, are you using any new soaps? Are you using anything that might be irritating to that really sensitive tissue? If you are doing antibiotics, you want to make sure you're on a really, really good probiotic that's taken at least 2 hours away from an antibiotic. You also want to make sure that you're taking care of that mucus lining, because if that is thinned or compromised in any way, it just leads to more susceptibility to that bacteria being able to attach to the wall of the urethra or the bladder. For some women, you want to rule out anatomical issues, and this is something that you do have to see a urologist for, but if there's any pooling of urine in the bladder or the urethra, that's an area that bacteria can start to collect. So that's something that for some women makes a really big difference in just understanding if there's an anatomical issue at the root of that. For some women, there's also some relationship things that have to be addressed, and that gets a little woo-woo. So it's not usually our starting point, but for several women I've seen, even just this year, it's something that we have to talk about. Often it's the elephant in the room. It's like, we've done a lot of other really good stuff. They're feeling great in other ways, but they're still getting UTIs. So we have to talk about what's going on in their relationships sometimes. So that's a starting point. I know this is something that affects a lot of women, and they're too uncomfortable or embarrassed to talk about this. So I'm just putting it out there, and that, if there's at least 8 to 10 million UTIs a year, and we're not talking about this and we're not preventing it, then it's putting a lot of women at risk too. And the populations that we really need to help prevent these in, like pregnant women and elderly women, we've got to get these things taken care of quickly and effectively. When I mentioned pregnant women, we want to make sure that we're preventing UTIs, because a UTI during pregnancy can cause preterm labor. And there's also less antibiotics that are safe to use during pregnancy. So for women who are hoping to conceive in the near future, if this is something that they've dealt with, then you absolutely have to get this taken care of well before you get pregnant. For elderly women, you know, the kidneys are often compromised already, and if a UTI is left untreated, then we can see that ascend to the kidneys and cause a kidney infection and long-term kidney damage. In elderly women and in pregnant women, you also have the issue of the symptoms sometimes being different, or not being able to feel the pain or urgency that comes with urination. They might have frequency, but they think, oh, that's normal because I'm pregnant, or you know, if I'm aging and my bladder is getting older, then you know, that would be another reason that you might have urgency or frequency. But as part of a routine patient screening, I'm always running a urinalysis just to make sure that there's nothing underlying their overall health picture, nothing urinary related, because they are so common. So if you guys have any questions about urinary tract infections or preventing them, or you know, if you know someone who struggled with this, please share this with them, because I have personally been through it. I've treated probably upwards of 100 women with recurrent UTIs successfully so far, and it's very humbling to help someone in that process because it is such a vulnerable area. So I'm going to take a sip of water and get my computer plugged in, since I'm running on really low battery. But if anyone has a question or a comment, I would love to hear from you. Hold tight. Okay. Well, thank you for those of you who tuned in on my first live video, and I love feedback, so if you felt like this was particularly awkward, I would love to hear from you, or if you felt like it was amazing, I would love to hear that too. Thank you all, and we'll see you soon.